Well, I am so excited to be here with Dr. HelenMari Merritt-Genore. She is a surgeon at Methodist Health Systems. I'm going to ask you what your specialty is, but I just want to first say thank you so much for joining me today.
Thank you, Andy. I really appreciate the opportunity. I am an adult cardiothoracic surgeon, which means that I specialize in disorders of the heart, the lungs, and the esophagus in adults.
Okay. And, one of the things that I wanted to talk to you about is the Go Red for Women, kind of that movement that's happening, that has been happening, honestly, for years. But how important heart health is, especially like right now, we're in, I don't want to go into the pandemic piece, but having a healthy heart is just so important regardless of what you're dealing with. So talk to us a little bit about that.
Yeah, you're absolutely right. The Go Red event for women started because we recognize that women are different than men in both their presentation and their disease progression for cardiovascular disease. So interestingly, 1 out of every 3 women in the United States will have some form of cardiovascular disease, whether it's a stroke, whether it's AFib, or whether it's disease or blockages of the arteries to your heart. And I think that we forget that heart disease is the #1 killer of women in this country. So even above breast cancer, lung cancer, all the other cancers, heart disease affects us.
So, okay, so let's kind of talk about, I want to talk about symptoms first and then prevention. But what are some of the things, because what I've heard, and I've been to this event for years, that we talk about the symptoms and they're a little bit different because sometimes there are no symptoms.
Yeah, women can be a little bit sneaky. So we think of the classic symptoms as an elephant on the chest, sweating, nausea, but oftentimes women don't present that way. They may just not feel well. They may feel like they have indigestion or GERD, and they may write those symptoms off and continue to put others' health in front of their own.
Yeah.
So women can present late in their disease progression.
And let's also talk a little bit about, so when you're feeling a little bit off, I mean, what do you do? I mean, obviously, you can call the doctor, but I just think it's so interesting because I at times feel a little bit off, and I kind of write that off as, either it's stress, because you don't want to, I guess talking from a woman's perspective, be like a hypochondriac where every time something happens that you're thinking, oh my gosh, am I having a heart attack? But should you be thinking, oh my gosh, I might be having a heart attack?
Well, I think it always has to be in the back of your mind. I think, dovetailing a little bit into your question about prevention is knowing your risk factor, knowing your family history. Do you have a history of early cardiac disease in your family? Do you have elevated cholesterol? Do you have a high blood pressure? Do you have diabetes? What is your sugar control? Are you a smoker? Are you obese? All of those things need to play into how high your risk level needs to be and your concern level needs to be.
Yeah, absolutely. And thank you. Those are great points. Knowing that risk factor. And but let's get into a little bit of the prevention. I mean, what can we do let's just talk as women to take care of this or to, prevent it, in the word prevention. Yeah.
Yeah, I think one big thing is just staying active, and it's easier said than done to stick to a really regimented exercise schedule. But there are things that we can do, little things that add up. So whether it's going for a walk with your family after dinner, whether it's parking a little further away at the grocery store, whether it's taking the stairs instead of the elevator, all of those things can help increase a healthy heart by staying active. #1 thing we can do is not smoke. And I lovingly put these into 2 categories: things we can modify and things we can't modify, but we can be aware of. So things we can modify are things like controlling our blood pressure, controlling our cholesterol. Things that we not necessarily are able to modify are things like our family history. We don't get to pick our parents, but we can know that risk, and we can talk to our doctor about our family history.
Absolutely. Oh my gosh, those are such great points, because there are things that you can actively, like you said, you have control over, like walking and what you eat and what you drink and all that good stuff. And then there's other things like your family history. Okay, let's talk about, I know the website, so there's lots of great information out there. And I'm looking at my notes, heart.org/Omaha Go Red. That's where there's a lot of information. And again, in this conversation, we're specifically talking about women and how we can just be healthy for our communities, for our families, for our kids. And
Yeah, absolutely.
yeah. So anything else you want to just share with us? And again, I'm hoping, as we talked before, we got the cameras rolling, to have a part 2 with you, because I think you have an interesting history and story of how you became, into this field. But just for the short term, maybe can you rattle off like 5 things that as women we can think about or do?
Yeah, so I think heart disease is not just the blockages in our vessels. It's things like congestive heart failure, when our heart stops beating like it should and starts to struggle. Signs of that might be swelling of your legs. It might be getting short of breath in activities that you used to be able to do without being short of breath.
Yeah.
There's stroke. That's a major cardiovascular risk factor. It's actually the number 3 killer in the United States, and it's the number 1 cause of disability in the United States. And then there's atrial fibrillation, which is a rhythm where the top chamber of your heart quivers and beats out of sync with the bottom chamber, and is related to both of those other 2. And then obviously the blockages in our heart, which is the number 1 thing that we have control over in preventing in some of our choices.
So I have a quick question. So when you're talking about the top part of your heart beating different as the bottom part, do you actually feel that? Or is that something you have to go to a doctor where they see that? Is that something that you as an individual can feel?
Some people may feel it. They may feel palpitations. They may feel shaky or tired or a little bit sweaty. And some people may just feel like they have less energy. So if you have any of those symptoms, it's important to talk to your doctor and let them tease out some of those things that it could be.
Yeah. Well, again, it's so important in heart health. I mean, I think there's the things that are kind of obvious, and then there's the other things that are not obvious. And again, so important for us as women to be healthy. And that's why I'm excited about the Go Red Forum and this movement that has been going on for years. And Dr. Merritt, I so appreciate you taking the time in your busy schedule to chat about this. And I look forward to, again, having a part 2 conversation with you as well.
Thank you, Andy. I appreciate it.